Hello everyone. One of the surgeries we do more often than before is testicle lifting. This is also referred to as testicle reduction in foreign literature. In fact, it's not a reduction, it is just taking the second testicle up. This is actually a simple surgery. There are a few tricks. This video is probably going to be short. The testicle hangs downwards in young people, usually in old age, sometimes in some diseases. For example, the patient is having hydrocele. It can happen after hydrocele. Even if he is young, there may be sagging in the testicle. Excessive sagging of the testicle is annoying. Of course, we cannot know, but as far as we understand something like this, while walking, the testicle gets stuck between two legs. If he is wearing shorts, they can hang from one side of the shorts. They can hang down from one end leg. If they are sagging this much, it is possible to collect it up by surgery. It is a very simple surgery. As I said, there are a few tricks. For example, surgery has to be done from the front of the testicle because there are more lymphatic vessels on the back side of the testicle. If you make a cut along the back, all along the length, the lymph circulation is disturbed. Therefore, the surgery must be done from the front of the testicle. We remove a large piece of skin, fold the rest muscle tissue upwards, and make the skin stitch in the form of zigzags. As I said, it is a simple surgery. Just the skin part should not be removed too much. In other words, it is necessary to leave the testicle to allow a slight sagging. Apart from that, it is absolutely necessary to fold the muscle layer inside because that's what carries the testicles. Apart from that, my advice is to make this patient stay in the hospital overnight. Why? The surgery is not actually a major operation. But when the testicles are stitched, the testicular tissue is a very bleeding organ, and bleeding will happen. The dressing gets dirty on the first evening. That's why I do it like this. After the surgery, I host the patients in the hospital overnight. The next morning, the dressing becomes dirty and a little blood is leaked. We change the dressing and discharge the patients like that because the man can actually go home on the evening of the surgery. He goes, but the next day the dressing gets dirty and very uncomfortable. We host him in hospital for one night, change the dressing, and send him home. Apart from that, recovery takes at least 2 weeks. It is necessary to pay attention to the testicle a little longer than 2 weeks. It shouldn't be too much. 4 or 5 days after surgery, I let the patient take a shower. It can be washed, but when he comes out of the shower, it needs to be dry so that it does not remain wet. As I said, full recovery takes a little over 15 days. Other than that, there is something interesting. These patients are extremely satisfied with the outcome of the surgery. I remember the first patient came to me. We had the surgery. The man came for checking later. For many times, he repeated, "God bless you, sir. Thank you very much for what you have done." The patient is more satisfied than normal patients. He thanked at least 4 or 5 times. Then we look at the books. An interesting event. It writes exactly like this in the book. These patients thank you more than patients of other aesthetic cases, it says. They would like to thank you at least 5 or 6 times because the life comfort of the patient changes. The way he walks changes. I read something like this in an interview. One of the famous black actors, it could be Samuel Jackson or Lawrence Fishburne, one of them would play an old man in a movie. He was going to play a very old man. The actor's coach made this advice to him. While walking, you have to walk like old men. How do old men walk? He asked. And the answer was this, as if there were 2 glass goblets tied between the 2 legs. You will walk on 2 legs as if two glasses goblets are tight or hanging. You will be careful not to crush these two goblets. Imagine that. Having said that, he actually described testicle sagging. As the elderly walk, they walk with both legs slightly open and slow. That's why it happens. Since the testicles are sagging when they walk normally, the testicles get stuck between two legs, so they walk with their legs open slightly. When we operate these patients, when we take their testicles up, they feel incredibly comfortable, and I have never seen a different event. The patient who came thanked many times. In other words, it is a surgery with the high satisfaction rate. It is simple surgery. As I said, there is some bleeding and infiltration in the first evening. We said this to the patient from the beginning. We will change your dressing next morning and then send you home. There is no other details about this. Is there any harm to the patient? No. As I said, if you remove the testicle excessively, this time the testicle will get close to the body. It needs to stay a little down. We plan according to how much the piece of skin to be lifted will be fixed. According to the sagging of the patient, it is not an operation with many details, but as I said, patients who learn that this can be done are relieved incredibly. I think they live really in comfort when this operation has been conducted and performed. Thank you very much for watching me. If you've got any questions, you can just email me or send me a WhatsApp message. My phone numbers are written everywhere. I am happy to answer you. Thanks again for watching.